This is the first case, that is Murugumbal versus Principal Secretary to the petitioner. Murugumbal was the mother of the deceased pregnant woman Kavitha, who died along with her male child during delivery at Government Raja Mirasthur Hospital, Tanjavur. Labor intensified at 2 a.m., at which point the attending nurse, without a doctor present, managed the delivery. A stillborn male child was delivered at 2:40 a.m. with meconium aspiration. Mother Kavitha developed PPH and she was transferred by ambulance to the government hospital Tirunelveli, where she died around 4:30 a.m. The allegation was absence of block medical officer and duty doctor during critical hours of labor. The attending nurse failed to summon a doctor despite recognizing labor complications and managed a high-risk delivery beyond her competence. Failure to perform an emergency cesarean section when it was indicated, poor management of labor, delay in referring to higher facility, and delay in managing the PPH. The defense was the government and medical staff denied negligence. They argued that Kavitha was a high-risk case who was managed effectively during pregnancy. At PHC, she was examined by the doctor every time, and they claimed that referral to higher center was made promptly and that the death resulted from sudden PPH, a known unpredictable complication. It was not a negligence. Patient was delivered by a trained nurse at night who managed labor as per protocol. Staffing shortage at PHC was due to sanctioned transfer, and the on-call doctor was available. They also noted that the patient had not always followed medical advice. The final outcome was that the Madras High Court held that the PHC staff were negligent. Nurse acted beyond her competence, failed to call the doctor in time, and delayed referral, leading to stillbirth and mother's death. Government was found vicariously liable. The petitioner's demand of 50 lakhs was reduced, 15 lakh compensation was given, and the verdict was guilty. Alka versus Vyas Hospital. The complainant was pregnant and under antenatal care at Vyas Hospital and consulting Dr. Ajay Sharma, Bilaspur, Himachal Pradesh. In 2012, she reported decreased fetal movement, was admitted to the hospital. In the night, the fetus was declared dead in utero by the doctor on duty at 2:45 a.m. and stillborn was delivered at 11:12 a.m. The complainant alleged that despite her reporting reduced fetal movement, the doctor and hospital failed to adopt the best practice of an early cesarean or timely intervention. It was contended that the delay in examining, responding to her condition, and in recognizing fetal distress amounting to negligence resulted in fetal death in the womb. Defense was that the respondents argued that the patient was classified as low-risk pregnancy, was monitored, and when she was admitted with labor pains were present. They held that fetal heart deteriorated in a very short time and the situation was unpredictable. They denied negligence, stating that monitoring was carried out, NST was done, and that hypoxia may have developed suddenly despite appropriate care. The final outcome was that the commission found that once the patient was admitted, she was under direct supervision of the hospital and doctor, and that the doctor should have recognized the warning signs. It held that the hospital and doctor were negligent in not adopting the best practice of early cesarean when fetal movement decreased and fetal distress arose. The appeal was allowed. Respondents held jointly and severely liable and ordered to pay 8 lakh compensation for death of fetus, 1 lakh to the complainant mother for agony, and 50,000 towards litigation expenses. The third case was Deep Nursing Home versus Manmeet Singh. Patient was admitted to the appellant nursing home, that is Deep Nursing Home in Chandigarh in 2005 for pain and lower abdominal discomfort. Labor-induced delivery occurred at 2:40. A male child delivered, resuscitated, but was declared dead at 3:10 a.m. After delivery, Mrs. Kaur developed atonic PPH. Blood grouping cross-matching was delayed. Transfusion started at 4:15 a.m. She was referred to PGI Chandigarh for uterine artery embolization at 4:45 a.m. but declared dead on arrival. The complainants alleged that the nursing home lacked adequate emergency facilities. There was delay in arranging blood, inadequate monitoring and improper referral, and death of newborn and mother was due to medical negligence. The defense was they had monitored the patient, induced labor appropriately, resuscitated the baby as per protocol, had looked into the case and found no gross negligence, the medical board. They argued that a normal vaginal delivery may not always foresee PPH and the delay in transfusion or referral was within reasonable limits given the situation. The outcome was that the State Commission held the nursing home and doctors guilty of deficiency in services for treatment, awarded a compensation of 20 lakhs plus costs. The grounds were failure to establish patient's pre-existing condition, that is anemia and hypotension, properly. The medical board noted records did not clearly show these, but if present, they would have worsened the PPH. Significant delay in cross-matching and starting transfusion. And nursing home did not have the facility for uterine artery embolization, and referral to PGI was delayed without proper, and there was no proper accompanying person with the patient, which the commission found was negligence. The third case is Dr. Ratna Jain versus Seema Sharma. The complainant Seema Sharma was a young woman under antenatal care at Pushpanjali, Agra, managed by Dr. Ratna Jain. She had normal pregnancy course, was admitted for delivery, labor was induced. She delivered a male child. Soon after the birth, the baby failed to cry and showed no signs of life. Efforts at resuscitation failed. Allegation was negligence during labor. The doctor failed to monitor fetal heart adequately. There was no continuous CTG, delay in performing cesarean section, improper use of uterotonics, lack of resuscitation preparedness, no neonatal specialist or equipment was ready at the delivery. Baby was born lifeless and could not be revived. Inadequate records, hospital documentation was incomplete and did not show any timing of oxytocin, fetal heart records, or staff notes. Defense was that the patient had a normal course of pregnancy. There was no indication of cesarean. Labor progressed well. Stillbirth was an unfortunate but natural obstetric outcome, not due to the lack of skill or care. She followed standard protocols. Fetal distress was not evident before delivery. The complainant was motivated by emotional distress rather than medical fault. The hospital was properly equipped and there was no evidence of gross negligence. The NCDRC held Dr. Ratna negligent, affirming the State Commission's order of 15 lakh compensation, absence of records providing adequate fetal monitoring or timely intervention, no evidence of an attending pediatrician at delivery, use of oxytocin without clear indication or supervision, delay in deciding on operative delivery despite clear fetal distress signs was there. The Commission relied on Bolam test and consumer jurisprudence, holding that reasonable care expected of an obstetrician was lacking. It emphasized that while stillbirth can even is in best hand, the lack of documentation, readiness, and proactive response constituted deficiency in service. The appeal by Dr. Ratna was dismissed and award was commissioned. Dr. Neelam Kakkar versus Bharat Kumar. The case arises out of consumer complaint filed by Mr. Bharat Kumar against Dr. Neelam Kakkar. Patient Juna Devi was admitted in 2003 in labor. Ultrasound was done. Lower segment cesarean section was performed under spinal anesthesia, during which the fetus was found to be dead or stillborn. Allegation was that the complainant alleged that due to negligence and deficiency in service, the child died in womb. They claimed that medical team failed to monitor or manage the patient properly, leading to intraoperative death of the baby. They sought compensation of 18 lakhs. The respondents denied the negligence. They argued that the surgery was necessary, that spinal anesthesia was administered, and there was a sudden cardiac arrest of the patient during surgery. They claimed that they performed resuscitation immediately of the patient, removed the dead child, treated patient giving blood transfusion, stitching, and post-op care. They emphasized that there was no proof that the child was alive before the operation and argued that death was medical misfortune rather than the result of a substandard care. The insurance company also denied liability, relying on the version of treating doctors. Outcome was that the state consumer held the burden of proof lies with the complainant to show the doctors acted below the standard expected of a reasonably competent practitioner. Applying the Jacob-Matthew standard, the court found that just because the outcome was bad, it does not necessarily mean that doctors were negligent. The commission concluded no proven negligence or deficiency in service. The doctors acted competently given the emergency situation. Cardiac arrest was certain. Therefore, the appeal was allowed. The earlier district forum order was set aside and the complaint was dismissed. Statutory amounts deposited by the appellants during appeal were ordered to be refunded. Next case was Priya versus Arumugam. The complainant Priya had been under antenatal care at Jipmer Hospital. She conceived, took regular checkups. In 2009, a stillborn baby girl was delivered, 1.8 kg. After delivery, she requested an autopsy of stillbirth, but Jipmer concealed records and did not cooperate. So Priya's complaints were negligent care during labor, lack of resuscitation or equipment, unexplained fetal death, concealment and non-disclosure, and she demanded a compensation of 5 lakhs. Defense from Jipmer was, they said that the Priya was a consumer, so forum was competent. They denied negligence, claimed she was examined by experienced obstetrician nurses, admitted in time, monitored clinically with ultrasound. They explained that IUD can happen even with proper care. Regarding the stillbirth, they argued that the fetus was fresh stillborn, indicating intrauterine death, not a prolonged death, that there was no visible sign of neglect. On autopsy, they claimed that the body was handed over to the complainant's relatives. Because of that, no postmortem was done. They also argued they provided due care and no deficiency in service or neglect occurred, so compensation is not justified. However, the outcome was that the district forum held Jipmer liable for deficiency in service and mental agony. If hospital argues intrinsic fetal death risk, failure to communicate, document, or allow autopsy can count against them in negligence claim. It awarded 25,000 compensation. It ordered 5,000 as the cost of litigation. The forum criticized Jipmer for lack of transparency. It noted that Jipmer did not produce convincing proof of handing over the body or conducting autopsy in a proper documented way. So whenever there is any death, either maternal or fetal, you must get the consent from the relatives if they are not willing for autopsy. So the medical legal takeaways from these case laws are, these cases underscore that adverse obstetric outcome are not automatically negligence. The standard is whether the medical professionals acted with reasonable care and skill per Bolam or Jacob Matthew. The onus is on complainants to provide credible evidence to prove that care fell below the accepted standards. Sudden intraoperative complications may not by themselves prove negligence if proper resuscitation measures are taken. Consumer fora carefully apply legal precedent to separate medical misfortune from the true deficiency in service. Thank you.